Essential Neuroscience. This is me, Professor Basudev Lahiri from IIT Kharagpur, and I am here to answer any questions that you might have regarding the first few chapters. You can ask me from any other part as well. I understand that I think up till section 9, up till chapter 9, module 9 have been covered. So I am here. If you have any questions, please go ahead. The discussion section is quite lively. I do get emails from time to time where the section is, people ask me questions regarding memory, regarding pain, regarding neurotransmitters, etc. So I'll be more than happy to answer any questions here in this live session. If you have any burning questions, so-called, I can help you out here directly, or else I can also answer the questions via email. Many of you are using the forum, using the group discussion forum. There is an email address associated with it. People ask me questions there. I'm more or less regular with it. So if you want, that could also very well be used. Essential Neuroscience, as you know, it was just the beginners aspect, beginners course. I tried to show you, I provided you a grand buffet of what Essential Neuroscience contains, entails. Obviously, not every subfield of Essential Neuroscience was shown. It is not possible. I tried to specialize or localize it into areas that I am particularly interested in. There are other areas outside of what I have taught. Obviously, several of them are taught as an NPTEL course by itself, specifically computational neuroscience. There's a specific NPTEL course taken by my colleague and very good friend from IIT Kharagpur available in NPTEL. So people could use that. I specifically made sure that there is no overlap. There is no overlap between both the courses. So my course had less amount of computation, no amount of computational neuroscience. If you are more interested in computational neuroscience, you need to check that course out. This was more from a neuroscientist point of view, and I have specifically made it through that it should be acceptable to people from any background. Here I have not specified background, and this was a challenge. This is something that I wanted people to see, people to understand, that they can be from any background, but if they attend, if they are serious enough, irrespective of their background, neuroscience have something to offer. So that's being said, the first few chapters contain perception, and sense, basically the six basically senses, five senses as such. And then from chapter 7 onwards, we have got cognitive neuroscience, and the last 3 chapters mostly dealt with the neurological and psychiatric disorders as such. So based on that, this thing was divided, this course was divided. So that's been said. I'm here to take any of your questions. If you have any questions, please go ahead. I will try to answer them to the best of my capacity. Thus far, we have received some very thought-provoking questions at the forum. So please go ahead if you have any questions to discuss. Right? The first few chapters are all about sensing. I have dedicated an entire chapter on vision because that is supposedly one of the most important one. Udibrotoji has replied, "Good afternoon, sir. Good afternoon to you, sir. I'm amazed by your zeal and your enthusiasm. Uh, in fact, I should be learning from you rather than you should be attending my course. My respect for you have gone quite a notch up. I hope I was able to uh, somehow manage through this difficult course up to your uh, up to your standards, how you used to teach when you were a teacher. I am ready for any criticism or any comments that you might have, or any question, of course. So to improve my teaching. Please go ahead if you have any questions. I'll be more than happy to answer to the best of my capacity. There is in the first, as I was saying, in the first, I think chapter 3 onwards, I have taken over vision, supposedly the most important sense. But I have also discussed about hearing and smell, touch and taste, etc. The motion perception, I didn't go too significantly inside. I even stole 2 lectures from that chapter to discuss brain anatomy, and I got quite a few questions regarding that. Thank you very much, Purvi Brotoji. Subject is more interesting. Subjects are usually far more interesting than teachers. But yeah, of course, neuroscience is a very interesting topic indeed. So yeah, the motion part has to be discussed maybe at a later chapter, at a later module in far more detail. I had to keep balance. I had to keep somewhat of a control. I didn't start with the brain anatomy because then people will be not from the medical background, who have not touched biology since class 10. Several of them are attending this course. If I start opening up the brain and start showing, it will be difficult. Urvi Protoji, I fully agree. The subject is very difficult to remember. There are so many lobes of the brain. I have, if you have noticed, sometimes some mnemonics I have given to make you understand or remember. But overall, since this is little bit medical related, and I am an engineer, I'm from electronics background. I'm an engineer. I know exactly what you are talking about, but medical field more or less have lots and lots of names and things to remember. So I have tried to make it so that you understand more than you remember. But after certain period, you have to memorize, like especially the lobes of the brain, what is limbic system, what limbic system controls, that hiccups that I have given, um, hippocampus, amygdala, thalamus, hypothalamus, striate, etc. So use some mnemonics such as these to remember it. But yeah, it will be. I mean, if you try, it will come up. It will come up. In physics or mathematics too, sometimes, well, not necessarily in mathematics, in physics and electronics engineering too, some of the laws and theories and formulas we have to remember. So every subject has its own quirks. Shivangi Goel asks, "Good evening, sir. I really love your teaching and the way you connect to the student. Thank you very much, Shivangi. Will you be covering the vestibular and interoception senses?" Shivangi, unfortunately, no. See, already there are people asking me that it is tough course and too much to remember. I have taken a little bit of vestibular aspect on, I think, section, chapter number 6, a little bit, but I'm not going too much detail onto interoception senses. I tried to focus more on the cognitive neuroscience. It's very, very interesting. I personally have a bias towards cognitive neuroscience. And I have also gone for neurological and psychiatric disorders, autism spectrum disorder, depression, schizophrenia, stroke, dementia, Alzheimer, Parkinson's, etc. So I have focused it more. If this course becomes popular, it's the first time I'm teaching it. It's the first time NPTEL have given some kind of a basic neuroscience course. So obviously not everything could be covered. Obviously, I also could not cover everything and there was mistakes from my side. So if this course gets enough traction, maybe there will be a part 2 where these are the things that I will try to focus on those things which I have not covered in this particular course. So vestibular senses a little bit. There are tubes in the brain. There are tubes in the system that ask you for balance, especially in the auditory cortex part. I just have touched onto it, but not so much so in interoception sense. Yeah. So please go ahead and thank you, Shivangi, for those lovely comment. Hope other people will share similar things because you either hate it or love it, that I have seen. Everybody has a preference for how the teaching is being done. So yeah. Right. If you have any questions, please go ahead. Syllabus is there. I have tried to stick to the syllabus more or less. I've stolen some lectures here and there, but more or less every topic that is put in the syllabus, I have had more or less faithfully discussed that and covered it. Apart from it, few more topics have also been added. So that was my point. Right. Any further questions from your side? I'll be happy to answer. Use the forum, use the discussion forum very much. Yeah. Right. There is a feedback also. Every week you finish your assignment, there is a feedback section. You can also send your feedback there. Let me know if we get feedback in between the class, that is always better, so that we can modify our lecture, going too fast, too slow, etc. Shivangi writes, thank you, sir. I work as a therapist for the autism spectrum kids. I wish to learn those concepts. I hope we have a detailed course on sensory issue with neurologically disordered people. Yes. Yes, Shivangi, I have discussed autism spectrum. It is I think it is chapter number 12, the first lecture, I think lecture number 56, where we have discussed 30 minutes, however you call it, 30 minutes, how much we can discuss autism. But I did discuss autism spectrum ASD to the best of my capacity. You can add ASD along with the other neurological disorder. Chapter number, I think 11 is for psychiatric disorder. So lots of other psychiatric disorder, autism spectrum is most importantly there, but other psychiatric disorders were also discussed. Anxiety, I think a little bit of what else did I discuss? Epilepsy, depression, addiction, yeah, sleep disorder, all of those things which have some kind of connection with ASD as well. ASD kids usually suffer from several other associated. Right, artist legend. He says, good evening, Professor. Many thanks for all the valuable teaching thus far. Thank you very much, artist. From the latest class, altered dopamine signaling seem to be linked with all memory disorders. Well, how many memory disorders do you know, artist? There are so many memory disorders, we are only beginning to understand. Dopamine is generally associated, since dopamine is associated with the reward function, it is somehow directly or indirectly associated with many other disorders, not just for memory. But you have to be careful. Dopamine is not necessarily the only thing associated with memory disorders. Several new aspects comes into effect. For example, when we study dementia, we see that it's mostly because of some misfolded proteins or plaques forming, Lewy bodies, etc. These are misfolded proteins, garbage basically forming, developing inside the brain, and that is preventing neurons from giving signals that basically attacks the hippocampus and thereby causes memory issues. So yes, dopamine is a very, very important neurotransmitter. Everybody knows about it, but let's not get too obsessed on dopamine and reject all other effects. It has to be looked into a much more holistic aspect. But yeah, dopamine is most definitely important. Thank you, artist. Right. Urmiprotoji says, I am taking personal counseling as a PG diploma course. Will this subject help me in the new field? Personal counseling based on Rogerian humanistic psychology. Urmiprotoji, that is a good question, and I don't think I'm the right person to tell you whether my course will help you as a personal counselor as such. You have to go and look into the course content, this personal counseling course, this Rogerian humanistic psychology. However, there is huge overlap. There is no doubt. I tried to take certain part of psychology. I have decided, I have given analysis of different psychological disorder, different neurological disorder. We have done case studies. These are at the later chapters, chapter 11, chapter 10. Case studies have been discussed where a particular person have been asked to a patient's case file has been discussed, and how you can differentiate between which particular neurological disorder this patient falls in. So I assume, I'm not a psychologist myself, and I am not aware of Rogerian humanistic psychology. I'm aware of cognitive behavioral therapy, CBT. So if it is, there could very well be an overlap between things that I have taught you and things that are present in this course. But you are the most important person to make that judgment, how much help you get from this course onto your counseling course. It's a fantastic thing that you have taken over personal counseling. Old age people, people like my father's generation, who after retirement suddenly finds themselves completely free, and that causes a huge problem. I have seen it in my father. He somehow internalizes that I am rejected from society, I'm rejected from work, I'm no longer valuable to the society, and that brings in depression after retirement. He has been a workaholic. He has worked too much for all his life, 60 years. He has, up till 60 years of his life, he has worked. And then suddenly one day, he was looking forward to retirement. Yeah, I am no longer interested in this work. I want retirement, this. But as soon as retirement came, he became very restless and very depressed at a certain period of time. So now he has, managed to cope up as the day passes. But I think if you take over this personal counseling postgraduate diploma course, it will help lots and lots of people. Just like we have physical illness, we have mental illness. There is no harm, or society has no problem if I go to the doctor saying that I am suffering from fever, suffering from cold and cough, suffering from stomach ache. But somehow society does not like if I go to somebody saying that, to a doctor, to a professional saying that I have I'm depressed, or I'm feeling extremely anxious, or I'm addicted to a substance or whatnot. I do not understand this dichotomy in our society, and we all have to come together to make it more mainstream. So if you go for a personal counseling course, then best of luck. I strongly support this. Thank you very much, sir. Right? Any further questions? I will be here to answer. Right. Dr. Surya Kumar is here. Hello, Dr. Surya Kumar. How can I help? I saw one gentleman calling from Sri Lanka. Our neighbors also go through NPTEL course. I'm quite happy. Hope I keep the standards high, because right, when your lectures goes outside, it does not just reflect upon you, it reflects upon your entire country or your entire institute or your entire department. So it's also needs to. Right. Dr. Surya Kumar can guide us how to prepare for NPTEL exam. So Dr. Surya Kumar, most of the question, or all of the question will be MCQ or MSQ, multiple choice question. There could be more than one correct answer. So you will be asked to choose the correct answer. There will be 4, 5, 6, 7 options. You will have to choose the correct answer, and there could be multiple correct answers. So if, say, suppose a particular question has 2 correct answers, if you have chosen only one, then you will get half marks. If you have chosen 2, then only you will get full marks. If you have chosen 1 correct, 1 wrong, you will get half marks. If you have chosen 2 correct, you will get full marks. If you have chosen the wrong options, both wrong options, or just 1 correct answers, for both wrong answers, 0. For only 1 choice, half marks. 1 correct, 1 wrong is half marks. To the best of my knowledge, there are no negative marking, but then this information is given by NPTEL directly. You can find it in there. So basically, many people ask me that I need to extend the assignment date. Please give me 1 more week. I was ill. I was this thing. If you have had been in my class and I have been personally teaching you, I could have allowed, but here it is not in my hand. We set up all the questions, exam and assignments, everything, and we give it to the NPTEL Center. NPTEL Center then weekly distributes all those lectures and weekly distribute all the, basically the administration is taken over by NPTEL. We have no hand. It's like your any class 12, class 10 exam. The teacher teaches you, but the exam is taken by a central or a state body, right? So that's it. Will that mention in the question itself that there are more than 1 correct answer? Yes, it will be mentioned in general, that out of 100 questions, say several questions will have more than 1 answer. It will not be mentioned in one specific question. In the general instruction, it will be mentioned that few questions in between will have multiple options. So it is up to you to figure out which one is correct. Right? It's general practice of NPTEL. I have not personally made anything tougher or easier. It is the general question format for any other NPTEL course. Mine is not an exception. So yeah. Right. Please go ahead if you have more questions. Right. There was a Excel file shared. You could have asked me questions there as well. apart from that, would also be taken. Yeah. Any more questions? Dr. Surya Kumar says that he is enjoying my lectures. Thank you very much. You are most welcome. That is the general idea. See, passing the exam maybe from a career perspective is very nice, but at the end of the day, what you will remember is how concepts that have been taught to you. So if you are enjoying my lectures, then that is my goal. I think the goal had been fulfilled. Thank you very much. I assume that several of you are counselors already, or going to be a counselor. I hope whatever I am teaching, especially in the later phases, chapter 11, chapter 10, will be directly relevant to you for counseling, and maybe it will help you in patient diagnostics, because this should be done. It should reach more and more people because it is unreported and untested. Right? Legit GP, sir, you teach very well. Thank you very much. Legit. These are your real name. Legit GP, artist legend. Sir, you teach very well. I'm shifting from clinical psychology and wanting to go into neuroscience research. I'm using your course to bridge the gap in my knowledge. Thank you very much, Legit. I'm glad that you like my course, and if this course could be used as a bridge between your clinical psychology to that of neuroscience research, even better. If you want some equipment, if you want, I mean, I have given some information about EEGs, fMRI, etc. Try to see if you can get your hands onto these equipment. These equipments will be required for you to analyze and for you to look into neuroscience. So if you have a background of clinical psychology, that is even better. You can utilize them for just brain mapping and whatnot. Thank you, Legit. Sir, the name is Gaurav. Made the username when I was very young. Okay, we all have had been at that stage, young and restless. So, right, Gaurav, best of luck for your transition from clinical psychology to neuroscience. Do you work with animals? Do you work with mouse? Because I'm thinking of, myself shifting into mouse model, mouse behavior, where I could work with rodent model, dissecting them, looking into their brain. Sir, my name is Nivita, artist legend. I am aware only now that my children have changed it. Okay, Nivita. This is a good name as well. Artist legend is, why not? It's a good name. So yeah, it's good. Dr. Surya Kumar, I am practicing psychologist, learning neuroscience to make my practice more evidence-based. Very good, Dr. Surya Kumar. I hope, as I said, the work that this course helps you in your practice. May you gain more patients far and wide, and may you be able to treat far more people who are distressed and who have difficulty. So thank you very much. Right. Any other question? Urvi Pratoji, if you have any questions, please go ahead. I'll be happy to answer. Use the forum, most definitely use the forum. Gaurav says, I am only in my bachelor's, but have realized neuroscience is my calling. Fantastic. When you know what is your calling at a bachelor's level, that is even better. I got to know my calling at a tender age of 40, already working in psychiatry department, and I'm preparing to go abroad and pursue neuroscience. Best of luck, Gaurav. I hope it absorbed into a legitimate lab. So, yeah. My best wishes to you, Gaurav. So, else we want to discuss here? How is the course? I mean, from a difficulty level, I want to know because I think is too much information is packed because I'm getting both sides of information. Psychologists or MBBS students, especially, are saying that it's not enough. They needed more about anatomy and uh, more molecular biology. So I have not discussed neurons from a deep molecular perspective. So some of them are asking for that. On the other hand, a few of you have also said that it's a difficult course and too much molecular biology or too much medicine or too much anatomy is going to make me lose interest in the course. I have tried to make a balance, but I fully understand that I will not be able to make happy everyone. Few people in both sides will be extremely, dissatisfied. Group of people will think that there is not enough medicine. It's only talking about from a surface, shallow level engineers, shallow level knowledge. Some people will think I'm going too deep into biology and medicine. So I do not want to know that much. So how do you think the difficulty level per se is it? So I would like to know what would be your honest opinion about the difficulty level. Is it too much knowledge, too less knowledge? Right. For beginners level, this content is balanced and good. Thank you, Dr. Surya Kumar. I hope the anatomy, well, you are from medical background, so I don't think anatomy was a problem. Several from engineering background complain. Right. Legit GP says, I have a love and inclination towards pure science, so I have no issue with the approach. Having a biology background obviously helps. Obviously, biology background usually helps. Nivita probably is also a psychologist, so maybe she was also okay with the biology content, but Urmi Brotoji probably had issue with anatomy, if not something else. See, at the end of the day, we all have to come out of our comfort zone. I am an electronics engineer. At this present moment, you have seen me handle with skulls and brain models. One of my student, without telling me, without knowing, open up the skull when it came to my laboratory. It came to my laboratory address rather than my address. So one of the student opened up the skull and got the scare of her life. She thought that it is actually real and someone has sent a skull. So that incident is also there, common among electronics engineers who have never seen this. So yeah. Urvibruta Bandyopadhyay said that the course may be divided into two, one for medical students and one for psychologists and counselors. What about the electronics engineers, sir? Why are you forgetting them? The engineers are also interested in neuroscience. The engineers, the physics people these days, biophysics and biomedical engineers, they are also quite interested in neuroscience. So for medical students, there are already MBBS related course. My good friends, the doctors of IIT Kharagpur, the doctor, not useless doctors like me, the actual medical practitioner teach neurology, neurology. So that is specifically catered for medical students. For computer science students, there is uh, computational neuroscience where they learn how to write Python codes, artificial neural network and whatnot. I thought that I have to cater to people who are in between, right? Neither computer science nor looking for writing codes, nor are medical practitioner who are looking for neurology and neurosurgery, etc. So I offered neuroscience for everybody else in between. Anybody was welcome. There were people from medicine, MBBS, MD, and computer science also coming up because they wanted to know more about the working of the brain. So yeah, the course is already divided into two. For medical students, there are neurology courses in NPTEL. MBBS is catered, like I catered toward interdisciplinary or engineering. MBBS is also catered by. So, sir, is there a diploma course where you get hands-on experience of the same? Nivita, there is. I do not know about diploma course. NPTEL has this thing in which you become maybe Urviproto ji can help you out. If you do several courses of the same type from NPTEL, you get some sort of a degree. Regarding hands-on experience, NPTEL allows both internship. So, for example, this particular course, if you do well in your exam, the top 10, top 20 people were asked to do an internship under the aegis of the same professor, for in this particular case, me, to do an internship. At the same time, if you are good at 2 or 3 different courses, you can ask for a 1-year pre-doc position. So I have a student, an NPTEL pre-doc. They stay with the professor's lab, in this case me, for 1 whole year, working as an apprentice. They are getting paid by NPTEL, both cases. The internship, which is for, I think, 2 months, the pre-doc position is for 1 year. They get enough money, but what is enough? And they learn hands-on, work. But then you have to relocate for 1 year or 3 months. You have to come and work in my laboratory. Right, legit GP, I find it best to self-study books and AI after watching the videos. As for the objective difficulty analysis, I think it may be a little difficult for non-biology students, only PCM. Good. Artist legend, yes sir, I have learned a lot on this platform. I find the physics part difficult. See, there is not huge amount of physics part, Nivita, that I have added. I am more from an optics background, so I have tried to explain the light part, color specifically in chapter number 4, where I have discussed this about the wavelength of light. But other than that, not much of physics, to the best of my knowledge, has been used. There is the ion channel movement and action potential, etc. But overall, I have tried to keep it relatively less. Dr. Surya Kumar, thanks for the mention of reference book in the course. Can you suggest some neuroscience website for further references and learning? So there are several websites if you want to go. There are several neuroscientists working in different parts of the world who keep on publishing their latest research. So there is Nature Neuroscience, ACS, American Chemical Society, Journal of Chemical Neuroscience, Journal of Neuroscience, Neurophotonics. These are online journals. Some cater towards more from a medical perspective, some cater towards psychological perspective. So peer-reviewed journals are there, which can be utilized for enhancing your knowledge. Neurophotonics is a journal. Several top-class scientific publication bodies carry a specific section of their work dedicated towards neuroscience. Try Nature Neuroscience, Dr. Surya Kumar. You will get to learn quite a lot. Nature Neuroscience is a genuine, very highly prestigious book, very highly prestigious journal, peer-reviewed journal. I think monthly or bi-monthly journal, which you can read and enhance your knowledge for the reference. Legit GP, but as a beginner's guide, the 12-week structure and how the content is divided, I think really gives a very good idea to have a foundation and study further. Yes, that is the point, Gaurav. That is the point. It's to give you a introduction, right? It's a beginner's guide. You might not like several part of it, but it will give you a choice of what to then look for and go forward to, and thereby you can take it further. So for example, you are more interested, I am more interested in cognitive uh, neuroscience. So if I want to go further, I would like to go on cognition. Some people are more interested in the psychology aspect or the disorder aspect, psychiatric disorder, neurological disorder. From a medical or psychological or psychiatric point of view, they will take that. Some people are more interested in measuring the sense and perception. So vision is a very, very uh, top choice these days, trying to restore vision in people suffering from these deadly diseases. I have a student here. So that's a hot topic, how to restore vision. So yeah, you can go for that on your choice. So yeah, let me know any further questions. Right? Any further questions? I'll be happy to attend. Gaurav said, do you know about the hard problem of consciousness? Any views? It is an intersection of neuroscience and philosophy. I often debate about a friend. It's not neuroscience and philosophy per se. It's more neuroscience and psychology, or neuroscience and psychiatry. So it's more about the executive function. It's more about emotions and language and sleep. So emotions are the one that is mostly considered the hard part of cognitive neuroscience, because the easy part, memory and attention, could easily be measured using behavior and ECG and fMRI. Emotion, sadness. If you are sad, you could be sad because you missed the bus. You could be sad because your team lost a cricket match, or you could be sad because of something personally happened to you. So how do you differentiate between those? Psychology or psychiatry has an edge towards it. They have tried to do it for, they have tried to understand human emotions from a long period of time. And Nivita asked, will you be including philosophy as well? Forgive me. No, no, no. I do not consider myself at all qualified to teach you philosophy. Already there are several raised eyebrows that why electronics engineer is teaching anatomy. So if I now already a section of people are already angry at me for encroaching their area. If the philosophers now that get angry, I will have no argument to against them. So no philosophy from my side. I'm not at all qualified. I have studied philosophy when I was a PhD student. It was asked by my supervisor. I was getting too much into. I was getting too focused on certain thing, and it was causing issues. So my supervisor asked me to study Indic philosophies. So I did that, but no, it's huge, it's fast. I will most definitely not bring it to the best of my capacity in any course. Maybe it has ingrained or subconsciously it has seeped in, but no, I will not be including philosophy. Dr. Surya Kumar, is it possible to train us in answering more than one correct answer in the remaining of the assignment? Okay, if you want, I will try to ask the TA to put assignments which has more than one correct answer. So, yeah, that could be done. Nivita, do you want philosophy to be added in neuroscience as well? Already people are complaining. There is philosophy course in NPTEL, Indic philosophy, Greek philosophy, Western philosophy, modern philosophy. So if you are interested in philosophy, you can do that. Recently, I saw that the structure of agonist bound CBGPCR was captured. I love how there is so much to discover in neuroscience. Cannot wait to be a part and contribute. Yeah, I mean, what I was finding when I was teaching this course, that most of the time my answers were for any topic per se as we do not know enough. We do not know why we are afraid. We do not know why we sleep. We do not know what is depression, etc., etc. So lots and lots of things to discover in neuroscience. Human brain or human nervous system is the most complicated system that a human being have encountered. Nothing in this vast universe that we know thus far defies our logic as much as the human brain and its manifestation of consciousness. We are nowhere as close about it. Artist legend Nivita, while relocating, I need to think, but the course has helped me with knowledge and confidence with the support of science. Thank you. You are most welcome, Nivita. I'm not asking you to relocate. I'm saying that these options are available. These options are available. If you have to do a hands-on training, you have to hands-on training in my laboratory, which you most definitely don't need to if you are going for it. If you have done it, if you want to do it in any other lab, I hope this course helps. Sir, that I leave it up to you. You have done your best so far. Thank you, Nivita. Hope you get something out of it. LGTP, what would you say are the prerequisites for the computational neuroscience course? Oh, Gaurav, this course is not taken by me, so I cannot pretend to say what will be the prerequisites. You have to go into the course's website and look for the prerequisites. It will be completely unmannered for me to make a judgment about the prerequisite of someone else's course. Computational neuroscience is not taught by me. So that professor has set up a specific prerequisites. You have to go to the computational neuroscience courses website, look for the prerequisite that she or he has put. And then I think computational neuroscience is taught by one of the computational neuroscience is taught by Sharu Bandyopadhyay from IIT Kharagpur. So you have to go and visit his website. Thank you, Nivita. Thank you for your kind words. Right? Any further questions? Yeah, Gaurav, just go through the course background. I think maybe a basic programming of Python maybe would help you, but the prerequisite, just go to the website. You will be. Several of the videos are already available, to the best of my knowledge, in YouTube. You can watch them without getting registered or adding it. There are several into the IIT KGP website, IIT KGP NPTEL website. Several individual videos are there of various courses, including computational and neuroscience, to the best of my knowledge. So just check one or two. If you like it, then continue for any other course. Thank you very much, Gaurav. It helped you a bit. Right, this is my office. This is not the NPTEL studio, so the camera quality are extremely poor. These are some of the photographs I have, which I also gave you in the vision course, made up of pixels, which your eye finally conjure up and you see images out of it. Right? This image behind me. Right? Many of my lectures contains images from paintings and photographs from medieval painters. So look for it. right? Camera resolution is not that good, right? Anything else you want to discuss? You want to talk about? Anything else you have in mind? If not, then right. If there are no further question, no further comments, shall we call it a day? Shall we end our lecture here? This live session here? Anything else you want to discuss? Right. If there are no more questions and no more points to raise, is there any way we can connect with you after the program? Sure, you can connect with me even during the program. I have my email address here, blahiri@gmail.com or blahiri@ec. Just Google me. I'm in IIT Kharagpur, Basudev Lahiri, IIT Kharagpur. You will know my email address. Just send me an email. I think I have sent an email to you directly. So B Lahiri, first letter of my name and then LAHIRI @gmail.com, all small letters, all lowercase, no number, no dash, nothing. B Lahiri @gmail.com. You can send me an email, or if you are in and around IIT Kharagpur, nearby Calcutta or otherwise, just come and visit my lab. I will be more than happy. Obviously, I will not be here in my office all the time. I have lectures to take. I have NPTEL courses. I have, my regular teaching with IIT students, advanced semiconductor device I teach, basic electronics I teach, laboratory I teach. So, but just send me an email. If you make an appointment, I will make sure that I genuinely make a time to meet you. Right, artist legend, sir, I had an opportunity to work with cancer patient. May I know how neuroscience can help such patients, maybe in pain management? Urmibrotoji, thank you, sir, for such long discussion. You are most welcome, Urmibrotoji. As I require your advice and criticism from time to time to keep me in the right path so that this could be improved. Nivita, pain management, see, I mean, from which point of view you are looking? Is it physical pain or is it like a more of a psychological pain that I'm suffering from cancer? What is happening to me and my loved ones? From that point of view, neuroscience can obviously help you. The neuroscience can manage the pain. Well, managing pain is more from a pharmacological point of view. You give medicine, but neuroscience can most definitely help you understand I mean, what kind of cancer? Is it some kind of neurological cancer, brain tumor, or it's a cancer in other part of the body? If it is a brain tumor, then like depending on which area the tumor have had happened, it will affect motion or vision or Broca area. So it will be language, etc. So that determines. On the other hand, if you are looking purely from a pain management, if it is a localized pain or if it is a neuralgia or fibromyalgia, this kind of pain, these are the pains where there is no physical issue as such, but you constantly feel pain. Fibromyalgia, neuralgia is just a general pain, just like migraine. So the issue is a bit more complicated. Neuroscience can most definitely help. You will gain knowledge from that point of view. But then cancer patient is quite specific. You need to give me a bit more detail on it. Okay. Any further questions? right? Right, if there are, okay, Gaurav, thank you for being here. Go attend your class. If there are no more questions, no more discussion, let me end the session here. Okay, goodbye. Best of luck with your future endeavors. And I will probably try to see you in another live session in the coming weeks. Okay, I wish each one of you the very best.